Our first presenter for Body Day is Dr. Jason Moss, CD, CFE. Dr. Jason Moss is the founder and executive director of CARE4U2, previously known as CARE4U2. He received his doctorate from Cleveland Chiropractic College and his bachelor's degree in clinical psychology from the University of Iowa. He is certified in NBCE physiotherapy as well as a certified functional evaluator. He was named a candidate for Fellow of American Board of Disability Analysts. Dr. Moss is an adjunct faculty member at Cleveland and a guest lecturer for the University of Missouri Kansas City School of Medicine's Integrative Medical Department. He and his wife, Lindsay, have 2 daughters, Maren and Lydia. His presentation is Breaking the Pain Cycle.
Good morning, everybody. So thank you for the introduction. That was really lovely. We've got a little presentation today. I'm going to go ahead and open it up for us here so we can get started. Technology. Here we go. So I think I can move forward using that. Yeah. Okay, here we go. So breaking the pain cycle. The thing about the pain cycle is I think that we cumulatively think about pain as one thing, right? So we think about, well, we've got a headache, or we think we've got back pain, and we put it in this small box, and we think about pain as only physical. And the cycle that comes between physical and emotional is really important, and you really can't separate the two. So what I'd like to do today is take some time to put those two things together for you so that you can really understand the process. A brief introduction about who I am and how this fits together. I started a company called CARE4U2 about 12, 13 years ago here in the Kansas City market. We're the only hospital credentialed manual therapy group in the Midwest. So what that really means is we are physiotherapists, chiropractors, manual therapists that function within a hospital system so that we can work with psychologists and psychiatrists and medical doctors and pain management doctors, because pain isn't just physical. If you take that into account, then you can actually do a little bit more. And that was our idea anyway. So my original degree is in clinical psychology, like she mentioned earlier. Why that's important is when I started, I was dealing with emotional pain. And through that process, it led me to where I'm at today, because I wanted to bridge that gap and be able to treat people who are in pain across those borders. So in that time, this is just a slide about the company and what we do. You're going to get a full introduction as we go through the process. But the key takeaway is myofascial release. So I want to talk a little bit about that early so that we can key it in later. The body system works interchangeably. When your muscles are tight, when your fascia, which is the covering of the muscle, is tight, it's going to lead to this feedback mechanism that we're going to talk about pretty quickly in this slide deck. So stress, anxiety, and the body. Here we go. Let's get started. Let me get a little drink here first. All right, now we can get started. So this is my favorite slide. If you don't listen to anything else, key into this slide. So if you start right in the middle there with pain, as you go on the right side of that on the deck to the physical cycle, you have a pain, so you have an injury of some sort. That is going to lead to you avoiding some activity, right? So you've got back pain, knee pain, hip pain, whatever it may be. So you're going to end up not wanting to do as much. So you're going to avoid whatever activities cause that. When you do that, you end up deconditioning or weakening your body. So you've said, I can't do these things because it hurts. So you stop doing them. Now your muscles don't work as well as they used to. And that's going to cause you to decrease activity even more, further avoiding activities, which leads to more pain. So it's this wonderful cycle that once you have a little bit of pain, it leads to more pain because your body deconditions. Emotionally, you go through the same response. So on this left side, you've got this same circle, except what happens is you have pain, again, emotional or physical. We're not separating the two yet. Whatever that pain is going to lead to fear and anxiety and stress, which is going to lead to decreased mood. You have decreased mood, that depression cycle. So you're going to have an increased perception of pain, which leads again to more pain. So these things work interchangeably as you go. So if you have any kind of injury of any sort, again, emotional, physical, it's going to lead to avoidance of activity. That leads to anxiety, depression, and stress, which leads to further deconditioning and further lack of that process, leading to more depression, more anxiety, and it feeds back on itself. So this can be a chemical, serotonin, dopamine, cortisol cycle. Again, we're going to talk about that in a couple minutes, but it can also just be physical because of just the pain itself, right? So we're going to talk about both of those things as we go. Let's hit serotonin and dopamine first, a key component. I'm going to go through it fairly quickly. It's a complex idea. Most of you know serotonin as kind of the feel-good neurotransmitter or the feel-good hormone because it works like a hormone in the blood. So let's keep that as our baseline. Serotonin and dopamine, they're the things that make us feel good. They're the things that we want to elevate. Cortisol is your stress hormone. So cortisol is the thing that is released when you're in that fight or flight mode. So when you're having something that's causing you to be stressed and anxious, cortisol is high, serotonin and dopamine are low. Just ignore norepinephrine. We'll get to that at a later date. So here we are talking about serotonin. If any of you have heard of any of the drugs people are on, so you say, well, I've got high anxiety, I've got depression, my doctor put me on blank, and there's so many it doesn't matter, but most of those drugs are serotonin reuptake inhibitors. What that means is they're trying to leave as much serotonin in the system as possible. So what we're going to talk about today is ways to keep serotonin in the system, but also ways to elevate that process. So setting the baseline, when serotonin is low, and if you think about the slide just 2 slides ago, the cycle, bottom right on your screen, you've got muscle aches and pains, depression, increased sensitivity, cognitive impairment. So just dealing with the right side there, I've got low serotonin, so I'm stressed, I'm anxious, I've got decreased cognitive impairment, so I'm not thinking as quick and feeling as good. I've got muscle aches and pains. I've got anxiety and depression that's increasing through that process. So on the left side, you've got chronic fatigue, low self-esteem, and then dietary issues, mood swings. These things fit in too. Particularly, I want to talk just for a second about the cravings for sweets because it's going to end up being part of our treatment plan later. So as your serotonin increases, cortisol decreases. As your serotonin goes down, which is what this slide is pointing out, muscle aches, anxiety, depression, but also this craving for sweets that come in. And as we know, that leads into that feedback. So now we're getting into cortisol. So I mentioned a minute ago, and we're going to actually go through the process of the cortisol serotonin cycle. But if serotonin is high, cortisol is low. If cortisol is high, then your serotonin drops. They have an inverse relationship. So as you'll notice, the symptoms of high cortisol and the symptoms of low serotonin are very, very similar. So as we're looking at this, you've got weight gain corresponds to the appetite suppression that we talked about in the last slide. Mood swings, same as the last slide. Increased anxiety, sleep irregularities. And then on this right side, again, we've got muscle aches and pains. Very important to what we're talking about. We're talking about pain and how it functions for both cases. Okay, so we talked about it a few times now. I'm going to say it again. The inverse relationship between cortisol and serotonin are incredibly important. The only thing we're really going to be talking about today is how to take that cycle, break it, or reverse it. That is the key component of today. So what would a treatment plan look like to do that? And I think what normally happens as we get to the next slide is when someone says, hey, I've got pain, or I've got anxiety, or I've got depression, we tend to focus on one element of treatment. So if I've got a headache, I'm trying to get rid of that headache. If I'm trying to get rid of my low back pain, maybe I take, maybe I go to a chiropractor, maybe I take Advil, maybe I take some sort of drug that really focuses on this pain that I'm having right now in this moment, kind of a snapshot of who I am. When a real treatment plan, if you really wanted to get in and treat your body like a living, breathing organism, whether it be, again, emotional or physical, you've got to look at it in different components. So you can't just say my back hurts today because I've got inflammation, but why do you have that inflammation? What can I do to prevent that as it comes, not just treat it when it gets there? I think it's one of the big problems with our healthcare system as a whole is that we're always trying to treat something once we have it. I've got pain now, I need to treat it, as opposed to thinking about our body as we're living emotionally and physically and trying to kind of prevent that as it comes. So a lot of what we're going to talk about today is trying to prevent you from ever needing me. That's probably a bad business plan. but that's what we're going to do. So let's start going through the 3 things that will prevent the cycle from occurring. Nutrition is one, we've touched on it a little bit. Exercise is a big component, and don't get too scared. I'm not going to have you lifting trucks or anything, but we need to start doing something to help. And then therapy, which is a big part of what our relationship is across the board. All right, so here we go. Things that we can do to increase and boost our serotonin process. So there are lots of foods that we can eat, and we're going to go through that process. Tryptophan is the big one. So I say tryptophan, everybody listening to me today immediately thinks turkey, right? So that's partly true. And if you go to this slide, and we'll go back again, turkey is on that list. It's high on the list, but it's not the only thing that can do it. So going back to this slide again, foods that will increase our serotonin are all tryptophan foods. And the reason for that is that tryptophan in the system mixed with the appropriate carb removes the tryptophan and leaves serotonin out in the bloodstream for us. So you can't just say, hey, I'm going to eat some turkey and that's going to increase my serotonin, but you can say, I'm going to eat some turkey and I'm going to eat this good carb, which is going to cause insulin to release from the pancreas, which is going to remove that and leave this serotonin out there. Again, very complicated process. We're just going to hit the basics today, but we want to boost that serotonin naturally, and you could do that through foods. But here are some food combinations that I would suggest. This is not at all complete. So as you're looking at it, be thinking about other combinations and other things you can do. I need you to do a lot of research to kind of go with your diet and what feels good to you. But the key I want to point is the good carbs and the difference between a good carb and a Twinkie or a donut. I think we all know that. I don't think that we all really think about it as much as we should. So increased sugar, and let's just say sugar, and that can be a soda, or it can be, again, Twinkies, donuts, whatever it is, that all of that stuff boosts your cortisol at a pretty decent level, right? But good carbs can decrease that. So a lot of times people talk to me about weight loss and dietary control, and I immediately go to mood changes, right? So if we're going to say, hey, what can I do for my diet to increase my serotonin? It's going to match very cleanly with the idea of what can I do to my diet so that I look and feel healthier. So for you, that is going to be different than what it is for me, and we need to take that into account. So I need you to look at your diet along with this process and decide what's going to feel good for you. That is the key to everything. Whether it's exercise or nutrition, we've got to tailor it to what feels good for you, not have this dietary plan that I'm going to hand you. So we're not going to do that. Let's talk about the foods as it goes. So turkey, chicken, both very high in tryptophan, oat bran, sunflower seeds, cashews, pistachios. These are things that I put on this list because they're things that I like. And then the good carbs on the other side, my favorite is going to be whole fruit, right? So someone says, I would like a snack, a fruit, a banana, an apple, a cherry is going to be much healthier for you in the long run, but we're so conditioned to eat that sugar as opposed to the fructose that it changes our process. This is a brief sidestep because I just read this article the other day that was talking about caffeine and its effect to serotonin and cortisol, and how many Americans in particular start their day with a heavy load of caffeine. So there's a study done by the Apple Commission, and obviously it's biased, but I'm going to give it to you anyway. The Apple Commission did a study where they took energy levels and from someone who had a cup of coffee or half of an apple. And what they found was people that had half of an apple actually had longer sustained energy than people that had a cup of coffee. So no one in here is going to say, I'm going to give up coffee and eat half an apple a day, but you should. So it's something to think about because caffeine increases the cortisol response. Caffeine decreases the serotonin response. And apple is a good carb mixed with the right protein. Now you're increasing your serotonin response, decreasing that cortisol response, and that energy is lasting for longer in the day. So why wouldn't we do that? I'm going to take a drink of coffee now. Okay, back to work. Sorry, got sidetracked. So exercise is part of the process. I think every time I say exercise in the clinic or when I'm lecturing, I think immediately people think about hard, grinding, lifting heavy weights exercise. And for somebody, that is exactly the right thing to do, right? Just like diet, it has to do with what you need and what is functional for you. So let's take someone that has been on a far right side of our cycle from that first slide. So they've had pain, they're deconditioned, they're frustrated, they're sitting on the couch, and every time they get up, it increases that pain because they've been deconditioned to the point that that process is very painful. And if you know that you're sitting on the couch and you're deconditioned, you're obviously going to have a high cortisol level and a low serotonin level, and you're going to be in that left side cycle of anxiety and depression and frustration. So if you take that person, you say, okay, I want you to run 10 miles and climb this rope, there's no way, right? There's absolutely no way to do that. But what if you just said, I want you to get up every 30 minutes and walk around the couch or around the house or around the living room? And you took these little steps to boost that aerobic factor to get you where you needed to go. It's about mind space more than anything. I think that we limit, there's a great quote that says, argue for your limitations and they're yours. What that means is if I say I can't, I probably can't. But what if I said I can do this first step, and that first step leads to the second, and we reverse that cycle? So here's the anaerobic aerobic process. Really important when you're talking about exercise. Aerobic exercise means that your body is using oxygen to produce that energy. So think about walking, light jogging, those kind of things you can do for a long period of time because you're intaking oxygen, it's producing energy and sustaining you as you go. An anaerobic process is using the lactic acid or the ATP system, and it's good for very fast movements. So let's say that I wanted to sprint. How long could I sprint, right? Maybe 20, 30 seconds, maybe a minute. How long could I lift heavy weights? How long could I blank? So that's what you're thinking. Anything that you couldn't do for a sustained period of time is in that anaerobic phase. And both aerobic and anaerobic factor into this cortisol serotonin pain cycle. So we're going to talk through that a little bit and try to touch on which is going to be best and when, because endurance is important, but also being able to quick move is important in that process. So here we go. So we talked a little bit about what would be better and when. Here's a good slide to talk about the value of aerobic exercise, walking, jogging, right? So I'm going to get out and I'm going to walk around the block. That's going to increase my endorphin release, which is going to increase my serotonin push. I'm going to get muscle growth, which is going to decrease lactic acid in there, which is going to, again, that right side right now, I'm not doing avoidance. Muscles are getting used. They're not deconditioning. Now they're conditioning. It's going to burn fat. So some people say, well, I didn't take in that many calories, or I didn't walk that much, so it couldn't burn that much fat. Here's a fun fact. If you're building and strengthening muscles, the muscle itself will burn the fat around it. So you don't have to necessarily put all of your energy into burn carb, intake carb. If you're building lean muscle, then you're going to naturally burn some fat in that process. Increasing testosterone, we're not going to deal with too much, except just know that as the testosterone increases, it decreases cortisol. What do we know about that? You know, increase serotonin and dopamine as that drops. And then the metabolism as it burns. Here's a key as we get back to that first slide again. What is that phrase? So objects in motion stay in motion, right? So if we are in a process where we're up and we're moving and we're burning and we're growing muscle and we're burning fat and we're increasing our endorphins or increasing our serotonin, we're going to tend to keep going that direction. Our body gets in a rhythm, right? Our body says, yes, this is where we're going. Let's go with that. On the other end, if we're in the process of sitting on the couch watching TV, eating ice cream, then our body's going to yearn and want that. We are naturally people that get into a rhythm as just humans. It's who we are, right? So if we're in a good rhythm, we're going to stay there. If we're in a negative rhythm, we're going to stay in that negative rhythm. So what I'm trying to do is convince you to take one step into that positive rhythm cycle for yourself. And this is a really great slide to help produce that. So we've talked about exercise. We talked a little bit about diet. Through that process, let's go mind and body now. Let's go with what our headspace needs to be. So if I said, hey, I need you to increase your mood and your place in your head, One of the ways people would do that would be possibly through yoga or Reiki or meditation and all of these other things that have lots of names that are really valuable, really in just finding some peace in yourself. So I said, again, side note, I said the other day to someone, I said, well, let's talk about meditating as a way to decrease your stress cycle, because a female, and she seemed really high stress, right? She had a lot of anxiety and she was worried about a lot of things. So I said, well, let's talk about meditation as a part to just give you a moment to breathe. And she said, well, I'm not sure about that. I'm a Christian and I'm concerned about that. And I said, well, here's the thing about meditation. Meditation isn't a religious philosophy, because you can use it during prayer. You can use it during time alone. You can be an atheist or a devout Christian and still take time for yourself, because there's no rules to it. There's no guidance to it, right? So if I wanted to talk to God and that was my form of meditation, as long as I did that in a peaceful moment, that counts. It works. There's been plenty of studies to talk about it. If I also wanted to be a Buddhist or a non-religious person and take that same amount of time just for myself in meditation, in deep thought, in just kind of the spiritual taking care of who I am as a person, it works the same way to the body. So let's not be nervous about it. When I say meditation, it can be whatever fits for you. So there's a study done in Boston, University of Boston, another one at Rutgers, and what they found was that during these times of meditation, and they were lengthy, right? So they're talking about 60 minutes of meditation. That's a long time. I meditate daily, but it's usually for 15, 20 minutes. It still works. So don't feel like you've got to get stuck to that 60 minutes. You can increase your serotonin levels just by taking a moment to be good to yourself. Just take a moment to be at peace and find a quiet moment and tell your body, I'm going to take care of you right now in this moment. It's incredibly powerful, and we don't give it enough attention. I don't know how many of you are out there. I'm married. I've got kids. I have a responsibility to my patients and the job. And every day I try to remember that at some point I've got to take care of me. And sometimes it's 10 minutes, sometimes it's 20 minutes, but every day I want to make sure that I do that, because I can't be good to other people if my serotonin level is low, my cortisol level is high, and I am going through that negative cycle we talked about earlier. So there's good research to point these out. It doesn't have to be something you have to believe. We've got good research that says this actually works. So combining exercise styles and meditation, we've already kind of banged through this a little bit, but let's walk through what a good program might look like for you, so that you're not like, well, I don't know how to start. So let's start with that walk. So let's say that you're not a walker, jogger, you don't exercise, you're deconditioned to the point that you're in emotional and physical pain. Let's start with just a walk around the block. You say, well, I can't walk around the block. That seems like a lot. How about a walk to your neighbor's house and back? How about up and down your driveway? See, these little steps make a huge difference. So when you get there, you start with this warm-up walk and you're going fast walking, that aerobic exercise. You're going to lead to a light jog, still aerobic, but for some of us, that could end up being anaerobic. Maybe you couldn't light jog for a very period of time. Then we're going to hard sprint. And that hard sprint is really important, but my hard sprint and yours are going to be different. So maybe that jog is really a hard sprint for you, because you're going to in that anaerobic phase, which causes that push in the body that we're looking for, because that push is going to do the muscle fiber stuff. We're going to increase strength. We're going to increase endurance. We're going to increase our power load. Then we're going to dip back down to that light jog, down to that walk, and then continue this cycle. Objects in motion. So we're going to continue this cycle, and we're going to do it every day. Well, I can't do it every day. Well, how about every other day, right? It doesn't matter. We've got to create the cycle and build up what's right for you. I'm not giving you a must. I'm giving you a let's fit it in for you and see what works best. So let's get to the stuff that I get really excited about. I am a manual therapist. What that means is I use my hands to work on the body physically, to break down and train the muscles for what we need them to do. So lots and lots of studies about the emotional response of tightness and tension in the body. So let's start with that, but then I'm going to talk about how to alleviate it. First step is talking about muscles and fascia and how they work together. So muscles work in a band. So think about my hands. When your muscles completely relax, you're in this phase. As you strengthen and you want to lift something up, muscle fibers shift and they slide in together, right? So this process is what creates the back and forth of a joint motion. As a muscle gets tight, this becomes this, right? So it's kind of halfway, not fully contracted, halfway contracted, but you can still use your body. This begins to break down, scar tissue builds in. So as that scar tissue builds in, now that muscle can't expand anymore. You can't use that tissue. So think about a muscle that's 10 inches long, and you've got this, which is kind of like a trigger point or a fascial lesion. We'll use it both ways. So as that fascial lesion or that trigger point takes up space, now that 10-inch muscle has a 2-inch lesion in it. That's taking up 20% of that muscle's ability. So you've got 80% now capacity as opposed to 100%. What would that do to your endurance? What would that do to your strength? And what kind of pain would that cause? Because it's going to decrease the motion of the joint. Let's go through that again. If you've got a 2-inch lesion and a 10-inch muscle, you are losing 20% of your endurance. So if you used to be able to run for 100 minutes, now you can only run for 80 minutes because you've lost 20% of that endurance. What if you used to be able to lift 100 pounds? Now you can only lift 80 pounds because you've lost 20% of your ability to lift. The muscles are incredibly important to just how we function because a joint doesn't move without a muscle contraction. So if I've got 20% less muscle contraction, I've got 20% less movement in that joint. That's not always accurate because gravity helps, but yeah, for this, give me that one. So if you've got a known decrease in muscle health, deconditioning, first slide. If you've got that going on, you've got this hypertonicity, you've got this tightness, this tension in your neck and shoulders, which is causing this reduction. We now know that that is causing an increased cortisol and a decrease in serotonin. We know that because there was a study done 10, 15 years ago, University of Miami, and what they found was in 30 minutes of deep tissue muscle release, what we do, there was an increase of, I think it was 30%. I've got it on the slide here. 30% in dopamine and cortisol, or 30% in dopamine serotonin increase, and a decrease of 31% in cortisol. So what that means is, in a moment in time, you can affect your mood by doing something healthy for your muscles, by doing deep tissue muscle release that retrain those muscles and break down that fascial lesion. Now, to be clear, I'm not saying that every time you have depression or anxiety, you should throw away all your drugs and just start having people work on your muscles. That is not what we're saying at all. What we're saying is, in a moment, this combined with this, all fit together to not just do physical pain, but emotional well-being at the same time. If you're only doing one of them, well, then you're only doing one of them, right? So as we go, we just kind of talked about this a little bit. I think people know what a trigger point is, but it doesn't necessarily have to be a trigger point or a knot in the muscle. It can be hypertonicity caused by sitting at your job all day, and those muscles get tighter and tighter and tighter. And you've seen people, right, that their shoulders are elevated up to their ears because they've just been in this tight position, or people that bend over so they're too far forward, those muscles become tight. Maybe you could work through that and say, well, there's no trigger points in there. They're in that hypertonistic state. We've got to break those back down. As your body holds that tension, it increases lactic acid. As that lactic acid increase, it becomes toxic to that area of the system, which is going to lead to inflammation because of that tightness. Inflammation leads to breakdown. Breakdown leads to pain. Pain leads to the cycle we talked about earlier. So here's just kind of a look at a muscle fiber and what we were talking about as that affects it. You know what? I forgot about one thing. So I think myofascial release has been a catchphrase, and I want to talk about that just for a second. So I was trained by John Barnes in the Institute. So John Barnes is a physical therapist that created the phrase and really invented myofascial release. So I think everyone kind of uses it now, but the process is really pretty simple. The idea is that fascia works like saran wrap around the muscle. So if you think about anything, and most of us have used saran wrap or plastic wrap, when you rip that saran wrap off and it sticks together, and you're trying to figure out how to get it to come apart, and eventually you can't figure it out, you just end up throwing it away and starting over. The fascia around the muscle is a lot like that. It's this clear, very sticky substance that wraps, and when your muscles get hypertonic or tight, or you get this trigger point, that fascia sticks together. When it sticks together, we've got to go in there and break it down so it can flatten again. Once you get that done and the trigger point released, then that muscle is going to get back to that 100%. You're going to get full joint movement. One thing that we also know is that anytime you've got decreased motion, you're going to have increased pain. How many times have you bumped your hand on something when you walk by or hit your arm, your elbow, the first thing you do is you rub it, right? What that's doing is it's adding this proprioceptive input. Proprioception is movement, nociception is pain. So if you have a nociceptive increase, in other words, I hit my hand, now it hurts, I can add a proprioceptive response that will decrease that nociceptive input. Part of what we're doing in this global phase is if we can get rid of that hypertonicity, if we can increase the motion, the muscle response, we can increase the joint response, and thus getting us back to where we need to go, reversing that slide. So here we go. Negative effects of a fascial lesion. Again, fascial lesion is just that sticking together, decreasing movement cycle, and it matches very cleanly with what we're talking about. So you've got a muscle that's deconditioned, it has decreased motion in it. Now you've got decreased strength, decreased endurance, decreased serotonin, decreased stamina, increase in cortisol, increase in pain, and that perception that builds that cycle. Okay, let's talk about a few conditions. We're almost done, I promise. So a few conditions that I see all the time, and I want to touch base on them. So fibromyalgia is a big one, and I think that people tend to believe that fibro is always this very large problem with intense pain, and sometimes it absolutely is, but it doesn't have to be. We have people that are diagnosed with fibro. And by the way, fibro is kind of a catch-all, right? What fibro really means is you've got unexplained muscle pains that aren't responding. There's no way to test for them. So we're in this position where we need to say something. We need to give it a definition, right? We need to give it a name. So we're calling it as fibromyalgia. Myalgia just means pain. So it doesn't have to be this all-inclusive point that everyone has. Some people can have fibromyalgia or a form of it just because we have low back pain or we have shoulder pain or we have neck pain that's unexplained and isn't responding the way we would want to traditional treatments. That ends up lining up with that. You can also have chronic fatigue syndrome, which matches with that, right? So I don't really hurt that much, but I'm just consistently tired and in need of sleep. So amplified pain syndrome is another one that I hear sometimes. They say, well, I can't be touched. Anything that touches me, I have this amplified response to pain. So these aren't just physical conditions. If you listen to those, so you got fibromyalgia, chronic fatigue, amplified pain. These aren't just physical disorders. They're what I would call a neuro-emotional physical disorder, right? So it's not just that your body is deconditioning, it's that there's this emotional response that you're having to it. So we have to work in both of those places. So I'm going to work in one, and we need to get someone else, a therapist, a counselor. We need to start dealing with these in multiple levels to really be good at it. So here we go. Fibromyalgia, the diagnosis stuff doesn't really matter. The treatment stuff really matters. So I've got unexplained pain that isn't responding the way we would expect. Are we doing the things that need to be done? Here's what we do in Western medicine. Western medicine, we have unexplained pain, and if we don't find the drug that is right for it, we end up a little bit lost, right? We end up throwing different things at it. So what I want to give you is a plan for that. It's going to require multiple people, but the plan is just what we talked about earlier. So it's mental health, it's exercise, it's nutrition, and it's somebody that's going to break down and retrain those muscles. So if you take fibro and you can take that to any disorder we're going to talk about, now we can expand that. So let's say that we've got headaches and migraines. What are we taking for it? As people say, oh man, I got headaches. Oh, I get headaches too. What are you taking for it? Not what are you doing for it? Not what is your treatment plan like? What is your cumulative effect thing? What 9 things are you doing, but what are you taking for it? So what we want to do is get away from that. Not that we don't want to take things for it, but what medicine am I taking? What exercises are you doing? What mindful breathing exercises are you doing? Who's your therapist? Who's doing your muscle work? Who is talking to you and working with you and coaching you through this to get you to the end of the cycle or to reverse that cycle? Fibro, headaches, same response. Low back pain, number one thing that we see in the office, also the number one reason for lost days at work, the number one diagnosis criteria for all chiros, PTs, OTs, any physiotherapists. Like that's the thing that we see all the time. And again, the response comes down to a 1-question answer. And it's almost always, what chiropractor are you seeing? So who's adjusting your back? Great question. But is that chiropractor doing muscle work? Is that chiropractor helping you find the right counselor? Is he talking to you about food? And sidebar, we don't sell nutritionals in our offices. And the reason for that is because I'm not an expert in nutrition. I'm an expert in triage is what I'm really good at, right? So I know what I'm good at, and I'm a really good manual therapist, and my doctors are absolutely precise with that. We don't do spiritual counseling. We don't do emotional health. We don't do psychology. We do the physical component, and we can refer you to a nutritionist. We can refer you to a psychologist. We can get you to the place that you need to go, because that's what we should be doing, right? We should be working. And that's the great thing about MyoCore and the bubble that I get to live in, because I'm across the hall from medical doctors and I'm down the hall from psychologists, and I have all these great relationships. So I don't have to be everything, because I'm not. So as we're working through that process, be thinking about, who else do I need to add to my treatment plan for me? Okay, so the last slide here is just about the body and the mind and how that works together. I think that I've hammered this pretty good, but let's do it one last time, right? So we've got anything that your body feels, emotionally, you're also going to feel. Anything that emotionally responds or resonates with you, there's going to be a physical response to that. So if you have stress and anxiety, you probably have some body pain, right? I haven't met anybody that I say, hey, how do you feel? They go, man, I'm really anxious and depressed, but my body feels great, right? It doesn't happen. So we have to recognize that these systems aren't separate. Your mind and spirit and your body are absolutely connected. So we need to be really cognizant of what we're doing and what we're saying. And that comes down to negative and positive self-talk too. Again, I don't want to get too far down this pathway, but what we say to ourselves matters in the mirror, and that matters to our body physically as well as emotionally. So let's be really careful about, how we're talking to ourselves and what we're doing. So I think that's the end. Yeah, I'm done. Should I scoot over? You're back.
I am back. Thank you so much for talking about the many signs of pain and the different factors that go into it. We do have 2 questions for you.
Sure.
So first question, at what point should someone seek treatment for pain?
That's a question that I should probably answer that in the slide, because I get that a lot. So here's the thing. I think the first thing you should do is that the day that you feel pain, you should start thinking about it, right? So what happens is we wake up today and we've got neck and shoulder pain. And then we go, well, we'll see how we feel tomorrow. We'll take some ibuprofen. And then the next day and the next day. And what happens is the body gets so used to it that it stops telling us about it. So now we've got this pain. Let's give it a rating. So out of 1 out of 10, let's say we've got a pain that's like a 4. So we get up and we're like, I think I can deal with it. I got to go to work. So we go to work, and then the body is telling us like, no, you've got this pain. But then the next day you've still got it. And after a while, the body starts going, well, I guess you're not going to pay attention to that. It's called habituation. But what the body says is, well, I guess that's not an important stimuli to you. I'm going to stop telling you about this minor ache and pain. I'm going to stop telling you. So then that 4 stays there, but you're not registering it anymore. Then it becomes a 6, then it becomes an 8. So now you're registering it again, but it went from my shoulder hurts to now I've got this intense shoulder pain. Now you've got an MRI, and the inflammation led to deconditioning, which led to a tearing of that fiber. So if we did a really good job in that first moment of pain of saying, okay, what am I doing to protect this? What am I doing? And that includes, anxiety and depression. I'm not feeling right. What am I doing to kind of reverse that cycle? So day 1, the answer is the day that you feel it. Doesn't mean that, hey, I've got, a little bit of a headache today, I need to call Dr. Moss right now. I need to quit my job and go there. But it means that we need to recognize that internally and say, okay, my job right now is to take care of myself. So I recognize I've got pain. I'm going to go in at least into my own thought process and think about what I'm doing nutritionally, exercise, manual therapy, counseling. What am I doing right now today? So we wait too long, I guess is the question.
Yep.
We all do. And I'm guilty too, by the way. It's not just you.
All right. And then our next question is, are there any pain management techniques you would not recommend?
Not really. Obviously, heavy drugs, we're getting away from the opioid crisis. So there was a study, there was a release by the AMA, American Medical Association, and the Joint Commission last year. And what they said is we've got to stop prescribing opioids first. I think it's what we're doing is we're saying, well, you've got unexplained pain. It's not responding to ibuprofen. So we're just going to go ahead and go straight to this really aggressive drug regimen. And what they said was from now on, before you can do steroid injections, before you can prescribe opioids, you've got to go through a conservative pain protocol. That's what we do, right? So they said from now on, before you can do that heavy aggressive stuff, let's do the stuff that actually has the body doing the work, which is what's really wonderful about my job. Is to say, well, he healed my neck pain or he healed my low back pain. Absolutely not. I removed a barrier and your body did the work it was naturally doing anyway. But we feel the same way about a drug. And most of the time that's not true. So a steroid shot doesn't heal low back pain, right? It removes some inflammation so that maybe your body can take care of it. But at that point, probably it's beyond that process. So I think the key isn't to avoid anything. The key is to go through the process correctly. So I have some pain. What am I doing in a conservative, minor approach to take care of myself? That's not working. Now we take that next step. I think the other thing is I think it's sometimes we do it, but very rarely do we do another professional's job. I don't know about you, but when my sink is clogged up, I don't do it. I call a plumber. Right? When my car breaks down, I never get out a wrench and start banging away at the engine to try to fix it. Yeah, for healthcare, it seems like we do that, right? We go, well, I've got anxiety and depression. I don't feel right. I'm going to self-medicate. And a lot of times that self-medication is really self-abuse, right? Whether it's drugs or alcohol or whatever the case may be. But for some reason, when it comes to our bodies and ourselves, we don't treat ourselves very well. And part of the process, I mentioned this the other day too, and I haven't fully thought this through, so bear with me. If we treated our bodies like we treat our cars, how much better off would we be, right? So we don't wait until our car breaks down to change the oil. We don't wait until our car, as soon as we hear a clanking, we're calling somebody, we're talking to somebody. Did you hear that? I think my brakes went, I'm going to take it in. But our bodies, we can have 8 out of 10 pain. We can't get out of a chair. We're like, I don't know. Maybe I'll call a doctor. Maybe I don't know. Like we just wait and wait and wait. So what would it be like if we just treated our bodies as well as we treated our cars? Again, that's an analogy I haven't fully worked through, but I think it's there, right? There's some.
Oh, definitely. Yes. No, okay. That was very helpful. Thank you for that.
You're welcome.
Thank you for presenting today and being one of our sponsors of the day. Our next presentation is at 10:15, and so maybe between you can take a quiet moment or walk around your desk like Dr. Moss suggested. All right.